Hello, this is Mr. Lavery. Good to see you, ladies and gents. I want to go over a quiz from October 23rd, as you guys have a test this week. And I want to go over some other things. This week starts the second quarter. So if you're behind or anything, you have till this Thursday to make up work. And then you just want to keep doing your lessons. You guys have been doing great. I'm very proud of you. If you have any questions, message me. Big thanks to Bianca and Viv for attending the interview last week, and I'll set up another interview in November. So this was a quiz from October 23rd, and I just want to go over it because we had some issues with these two questions. People are getting things mixed up. Then I'll go through the week at a glance. So first, with this, people were getting lateral and deep mixed up. Located further from the point of attachment is distal. Lateral is to the side. Away from the surface is deep. Caudal is tail end. Lying face down is prone. Move my face. I hit next. All right, so we had to drag and drop the organ into the right current quadrant. Now, so if you look at this picture, the colon and the semicolon, the colon and the small intestine are in all the quadrants. And the liver, most of the liver is in the right upper quadrant. Most of the pancreas and the stomach is in the left upper quadrant. And those are things people commonly get confused. I'm going to pause this for a second because somebody emailed me. And that was nothing. So we got to go to the bottom here. Right ovary for the female is in the right lower quadrant. The majority of the pancreas is in the left upper quadrant. The prostate for the male is midline. The gallbladder is in the right upper quadrant. And then the left ureter is in the left lower quadrant. So I'll scroll up so you can take a look at those. I'll move my face. My face keeps getting in the way. Here we go. Next. The combining form for fat is a dippo, and mostly everyone got that right. So good job. All right, so I'm going to take a break from that. I'll show you another quiz tomorrow. So X out of here. And I'm going to go back to body structure. So at the end of the folder here is a test on body structure. Okay. And there is a number of quizzes. Actually, I'll go over another quiz in just a minute. So you want to study your quizzes and exit tickets. This quiz was from October 30th, and we had trouble on that as well. So we'll go through that. So match the system with the common effects of change. This is a difficult question. It's really putting a lot of stuff together. But the loss of ability to regulate body temperature is the integumentary system. That's your skin. Less aware of pain and injury. That's your nervous system. More difficult to take breaths. It's your respiratory system. And incontinence and bladder infections is your urinary system. The position describes the body standing erect with arms at the sides and the palms of the hands facing forward is the anatomical position. The tissue that lines internal organs and serves as a covering for the skin is epithelial tissue. Next, the word for tongue, under the tongue, is sublingual. Sub is the word for under. Next, the combining form for fat is adipo. Next, and here's those terms again from the previous quiz. Located further from the point of attachment is distal. To the side is lateral. Away from the surface is deep. Tail end is caudal. Lying face down. So you can see the exit tickets and your quizzes are showing up on more comprehensive quizzes and the test. So good luck. Study hard on your test. So let me digress and we'll look at this week's work. which isn't too taxing because I know it's the end of the quarter and some of you are trying to catch up in your classes. So if you look at this, you're going to do Google Slides on a pathology term, okay? And then there's 2 exit tickets, so you can take this, do this Wednesday and Thursday. You can do it before if you want. So you got to read these directions. And then, so it's Allied Health Skin Pathologies, 25-point assignment. It's due Monday. You'll create a presentation on the assigned term. So you're each are given a term, and then after you guys hand it in, I'll put all the slides together so you can have them to study. We'll focus in on these pathologies. There's a lot of different pathologies of the skin. We'll look at some others and some other skin conditions, but we're really going to focus in on these. All right, your first slide, you'll have the title and topic. The second slide, you'll do a pre-test, a couple questions that will be answered by your presentation. So together those things are 10 points. And then the 2 slides, 2 through 4, is what are the causes or signs and symptoms of your condition and what is the treatment. And then the last slide is follow-up questions. They could be stuff that we should learn from your presentation or more critical thinking questions, and that will be 5 points. Just a good form would be if you get your information from a website, you should cite your work. I forgot to put that part of the rubric. We'll let that go for this time. I'll remember to do it next time. So that's Thursday and Friday. And then no, that's Wednesday and Thursday and Friday. You have some simple notes on the skin. Should be a lighter week. It's not as much work because it's more challenging. I wish you luck, and if you have a problem, let me know.